Hello and welcome to the Nurse Rosa's Insights podcast. I'm your host, Rosa Hart, and joining me today is Sarah Waimon. Thank you so much for being here today.
Thank you so much for having me.
So, Sarah is one of the first nurse inventors to be on my podcast. So, I am so excited about this and I cannot wait to hear your story. Your invention was incredibly relatable to me, and I really wish I had it back when I was working in the ICU and dealing with a lot of bodily fluids every day. So, Sarah, would you tell us about Looey and how that came to be?
Absolutely, I'd be happy to. So, I've been a nurse for the past 16 years. And just a few years ago, I was working on a colorectal unit, and we had a majority of our patients had new colostomies. And so, quite frequently throughout the day, we were rinsing out the measuring containers. And one day, when I was rinsing one of them out, I got splashed in the face. And even though I've been a nurse for 16 years, like, this wasn't the first time this had happened.
Oh, no.
Yeah, it goes everywhere.
Very relatable. Yeah.
But I finally was like, "You know what? Like, I wanna do something to protect nurses, make our jobs easier, make it safer." So on my way home from work after that happened, I was driving home and I was like, "All right, what can I come up with that will, prevent this from happening in the future?" So I came up with the idea for a splash guard that would attach to the existing bedpan washing hardware. And I came home and I made myself like a little cardboard cutout as my first little prototype. And then I like painted it with like a basically like a rubbery type um paint so that
Mhm.
it would be like waterproof so I could like try it
Oh,
on something and then make sure it was actually going to fit on the bedpan hardware.
mm,
And then from there, I worked with a company that was local in Rhode Island, and they helped to 3D print my first prototype.
that's
So,
awesome.
yeah. So then after that, I was still like, all right, well, how do I bring this to market? Like, how do I get it to the next phase of design and development? And I actually kind of stumbled upon this company called NEMIC. It's NEMIC, New
Mhm.
England Medical Innovation Center, and it's right here also in Rhode Island in Providence.
Convenient.
Yeah, absolutely. So they basically, it's free to Rhode Island residents, but they have courses that they run through the year and accelerators, and they teach you basically like soup to nuts how to bring a medical device to market. So I enrolled in their MedTech leadership program, and took that class, and then was able to pitch in front of a crowd of like I think it was like 150 people or something like that. Um, and now at this point, I've created this refined design, and we're now going to be talking with manufacturers to have Louis manufactured.
This is just utterly exciting. Did you ever think you would be engineering a medical device?
No, I didn't never thought I would be like first of all, I never thought I would be running my own business.
Oh, yeah.
And like I think a lot of nurses are very creative, or like
Mhm,
people in healthcare in general are creative.
mhm.
And we think of ways to solve problems. Um and we're always saying like, "Oh, well, what if this existed or what if that existed or if only, there was a little piece of something that made my job easier or whatever." Um but I think that it's important that nurses and caregivers and doctors take those ideas and bring them forth into the world so that we can, protect patients and protect caregivers.
Yeah, and I'm just so excited when I see nurses doing that, and I got to participate in the nurse hackathon at Health, the conference a couple of years ago, and, I've gotten to observe some since then. The last one they did at Health in Vegas was a make-a-thon where they did what you were talking about as far as printing out the hard copies of the prototypes, whether it was 3D printing or like, they had other ways to make prototypes. I didn't get to see them all at work, but to take your idea from something abstract into reality where you can hold it into your hands has got to be like like a mind-blowing experience. Do you feel like Was that hard to find somebody to 3D print the idea and to get that all situated before you found that accelerator program, or was that pretty easy because so many people have those now?
Yeah, it was easy because, so another resource in Rhode Island is a company called RiHub, again, another non-for-profit.
Well,
Um, and then Polaris is part of them, or they
mm,
referred me to Polaris. I forget the exact
okay,
details there. But anyway, there's all these people who like want to help small businesses and, help people out who are trying to build something in Rhode Island. So they actually referred me to a 3D printing company right in Quonset, in North Kingstown, which is, close to where I live. And, I was able to just go one day after going to the beach, and I came with my little, cardboard cutout prototype, and I said, "Can you make this, into actual 3D printed model for me?" And they, whipped it out in like a week. So,
right. And was your goal to start a business out of this, or so was it necessary to start a business in order to do this, or is that like an extra step that you added on?
yeah, it was an extra step that I've added on. Like I could have just been like, "All right, well, I'm gonna, get the patent on this and I'll, license the rights and, collect some money on the side." But um the more that I went through the process, the more the more passionate I am about it, and I'm like, I want to be a part of this, and I want to see it go into hospitals and know that it's helping people, and I want to have my hand in it.
That is just utterly beautiful. So, were there any like nurses or like other mentors that were able to help along the process of like maybe testing and getting the word out?
Yeah, so far I did a pilot study at South County Hospital in Wakefield, Rhode Island.
Mhm.
And they've been incredibly supportive and letting me do the pilot study there. And then we've tested it out on each department. So we went from like the medsurg floor to the telemetry floor, orthopedics, and then the intensive care unit. And all the staff has been really excited about it. They've been really supportive as well. And it's just nice to get like the feedback from staff who are actually using it and to hear their stories too. They're like trauma stories about being splashed and stuff like that. So,
Where they're trying to one up each other with how gross the thing
yes.
was that they got splashed with.
Yeah, although I feel like I have them beat. I'm like, I got colostomy contents in
I
my
mean,
face.
unless it's a colostomy unit and it's like that's what they're emptying.
Yeah.
But it doesn't matter, like,
Mhm,
I I feel like I got pretty lucky, I only got something in my eye once, it was like
mhm.
sputum. Um, Whenever I had any other kinds of bodily fluids splashed on me, it was, like, on skin that then got absorbed, but not in on our mucosal membranes, right? Which I guess is
Yes.
even scarier.
Yeah, and that's the other thing too. It's like, if you get a splash injury, um, not only is it like I don't know, you almost feel like you've been violated, like you're worried about, contracting something that maybe the patient has. And then also you're then being pulled from your unit to go away from your patients, and maybe your coworkers have to absorb your assignment so that you can go get taken care of and checked in the emergency room. So, I'm hoping that
I don't know. Is that a
yeah.
process that people do? Take people to the emergency room? I had to go to, like, get my blood drawn later. It's like, wash it off
Oh,
now, and then we'll do blood draws on you, and we'll do blood draws on the patient, see what
mhm,
they have and what you might get, what you already have, so that if you get
yeah,
it later, we'll be like, "Oh, this was connected." And I
yep,
think they even made an example of that on The Pit, right? Did you see
mhm.
that episode?
I didn't see that episode, no. I'm
It
just
was
starting to get
much
into it.
longer.
I was a little hesitant to watch it because I was afraid I was gonna, like, get triggered by it.
Mhm. No. Just the most validating feeling
Yeah.
it is watching that show because, I always really struggled with feeling like my friends that were non-medical and my family couldn't relate to what I was experiencing at work, and I couldn't describe it in a way that really resonated, but the way that the pit has been designed was so intentional to really let people emotionally enter into the experiences that we have working in a hospital. So, yeah, I really encourage you to see it. So, especially so then you can refer back to it if you're talking to someone who is not in healthcare, and you can be like, you know what, if you watch this episode, then you'll totally get what I'm talking about. And I think for things like what you're doing, the Louis, for example, bringing home the importance of it and um, the impact that it has on the caregiver who gets splashed by things. It's not over in that moment when you clean it up. Like, you may have months of lab draws to look
Yep,
forward to and hope that you didn't get HIV or something, you know?
exactly. Yeah.
Let alone some bacterial infection that you can get cleared
Yeah.
up with antibiotics, but still, you know. Um, so are you originally from Rhode Island?
I grew up in Massachusetts, and I've been in Rhode Island for the past, I think it's like 15 years or so.
All right. So most of the time you've been a nurse, because I think you said you've been a nurse for 16 years, is that right?
Yeah. Yep.
Okay. Awesome. And then, did you always wanna be a nurse, or that was that a pivot for you that surprised you?
Yeah, so the reason I became a nurse was my gramps was on hospice care. He had pancreatic cancer
Mhm.
when I was about like 13 or 14 years old.
Mm.
And so he went on hospice at home, and I saw that just how compassionate the nurses were coming in to take care of him and everything. And I was always just like really inspired by just like how like angelic they were, and how
Aw.
much they helped, like, not only him, but, like, our family, and,
Mhm.
that's just something that I wanted to do.
That's awesome. Yeah, I actually pivoted to nursing from music because my grandfather had a heart attack and a similar, experience of just, like, that was my exposure to a part of healthcare that I hadn't been routinely, like, going to wellness checkups didn't inspire me enough, I guess. I don't
Yeah, no.
know. But, that is so important because, like, that's how we prevent things from escalating and getting
Mhm,
out of control. So I'm actually a lot more excited about preventative care now after seeing, what you've seen, all the suffering that we have encountered. So, um, are there any other devices that have come up in your mind since you've done this? Are you just, like, laser focused on the Louis device?
yep, I've got the Louie, and then I have one other device that I'm working on, so
Oh, more patents are coming, huh?
mhm,
That
let's
is
hope.
so cool. And then, were you nervous to to do your pitch in front of 150 people?
Yeah, I was so nervous. I'm, like, I'm a little bit on the shyer side when it comes to, like, public speaking and everything, just because I think it's because I don't have to do it, you're in like our day-to-day jobs as nurses, we're talking maybe to like a couple family members and to our patient, but you're never in front of like a really big crowd like that. So
Mhm.
I was definitely anxious about it, but the people at NEMIC and everything really helped prepare me for it. So
Right. I'm really excited to hear about these accelerator programs that you
mhm,
found. And I know, so I live in Kentucky and we have several accelerator programs as well as like small business development councils and things like
yeah.
that. Now, for your accelerator, was it a lot of business type coaching in addition to the medical device side of the business? Or like, was it all packaged in one?
Yeah, so a lot of business advice and like helping to set up my business, as well as preparing everything for my patent. So I was able to fortunately, like, get some funding for that because I don't know if you know, but, like, patents can cost quite a bit. Um, and so it
Does it
was
cost
really, really
different
helpful.
amounts for different kind of patents?
Yeah, so you have to pay first for, your, provisional patent, and then you have a year to file for, like, the actual patent.
Hmm. Why do you need a provisional patent? Sorry, this is actually completely new to me.
Yeah, yeah, so the provisional patent is basically, like, your little, like, it holds your place in line kind of. So, like,
Oh,
um when I had filed for that, I actually did it myself because I was like, "Alright, I don't have money to be, like, giving money to lawyers and have them do it." Um, and fortunately, like, the trademark office and everything, patent and trademark office makes everything pretty user-friendly for you to kinda figure out and do. I'm like, "Alright,"
yeah.
so I do that all myself, and then, And then, yeah, so basically it like holds your place in line so that if, you know, if somebody were to come along and say like, "Oh no, I wanted to, I'm submitting my patent for this." I'm already like in the front of the line for it.
That's awesome. And then now, after you've already had your study to kind of see how it would work out, what's the next step for Louis?
So the next step is I'm working with some industrial designers from Niche is the name of the company, and they've been so incredible. Um, but they've made a couple little design refinements so that like one of the things that we learned in the study, for instance, was at first I thought that I wanted the Louis to be able like I wanted it to be easy removed so that if a nurse or somebody or housekeeping needed to like clean inside of it or whatever, like if anything got
Mm,
kind of caught underneath it, they'd
okay.
be able to take it off, wash it really good. But with my study, I've realized like, nope, we just need to like have a gasket in there and we don't want people like tampering with it. We want it to just basically be part of the toilet at this point.
Mhm.
Because I mean, we had patients take them off and like one was using it as a makeup tray.
Oh, dear. Oh, my. Well,
So yeah, I mean, that was also very
resourceful.
like clever.
Mhm. Yes, very resourceful. Love that for
um,
them.
but it'll make it a little more stable too. So
Exactly.
yeah.
So
And so
oh,
yeah, so
yeah.
the industrial designers are making those little changes and then they'll 3D print, that model. I'll test it out just to make sure it fits everything right. And then from there we'll be talking with manufacturers to have a tool made. So that's really like the exciting part. I just can't wait for that to happen. Um
Wow.
yeah.
So then what do you picture your life being like after it's out? Like, are you just wanting to see what you can design and invent next, or what do you think?
Yeah, I figure I'll get this up and running. I'm hoping that I'll, get it to some conferences, nursing conferences. We went to the Magnet and Pathways conference this
Yeah, how'd
past
that go?
October in
Mhm.
October. Yeah, it was awesome in Atlanta. Um that was incredible. It was such a great experience just like I love like talking with other nurses and stuff
Mhm.
and hearing their stories. So I'm hoping, once we get this going, I'll be able to do more of that. And then yeah, coming up with the next device.
Yeah, and I think a lot of the times disregarding the imposter syndrome that we have of expecting, "Oh, I guess we'll just have to wait for engineers to do that." I think there's also kind of this wondering of surely somebody has invented that somewhere, we just don't have it, right? So was there a
Mhm.
process you had to go through to check out the market and see if anybody else had already designed this and it just hadn't made it to where you worked?
Yep. Yep. So did a lot of research, making sure that something like this didn't exist, but also that there weren't already existing patents on it, which is also what we use the lawyers for, the patent lawyers. They do like a full on patent search. Like you can do one like a little preliminary one yourself on the website, but yeah, they did the dirty work for me.
Nice, yeah. And so I think, I've seen some people who, they make something and then they find out there was a pre-existing patent and
Hmm.
then it just gets stalled at that point. So, um, but I'm just so excited to see this because I've been talking to a lot of nurse entrepreneurs who are in business in various different ways. But I don't think I've run into a nurse inventor of a device before. So I thought this was very exciting. And it reminded me of one of my favorite interviews with, I think it's Jeremy Bronin, and he invented the SedMed toilet seat. Did you see him at any of your conferences?
Yes, I met him. I met him at the Magnet and Pathways conference.
Ah, I'm
Yeah.
so jealous. I haven't met him in person yet.
Mhm.
But isn't that just brilliant? You can just use 2 fingers and help somebody who's like 450 pounds get up off the
Yep.
toilet without hurting yourself.
Yeah.
Again, so simple. But,
Mhm.
like, I was at a different conference and they were showcasing this lift off a toilet device that used electricity and it was thousands of dollars, and then he's got this little device you just screw on like a normal toilet seat and it just works with leverage, and I'm like,
Yes.
"The simple things can be the
Exactly.
most brilliant."
Yeah. And then I know there's times where I'm like, "Okay, like, this isn't, like, it doesn't use AI. It's like this is literally just like a shield so that we don't get poop in our face. And I feel like I'm like, oh, this is so simple, but like
But also, why
we need
has
this.
it taken this long to get this,
Yeah.
right? And so I think maybe as nurses, we can start using thoughts like
Hmm.
that as a trigger for, oh, this is an opportunity where you're like, why isn't there something to fix that?
Yeah.
And instead of just being frustrated about it, say, oh, is this my chance to fix it, to make a solution, or to develop an invention, for example? I think that also the word opportunity may have been hurt for us because I don't know about you, but it means something that you can do better next time on.
Yeah, exactly.
So it doesn't have the same exciting ring to it that it might have otherwise. But yeah, I think this is our chance to just put ourselves out there. You bet on yourself. You did it in your time outside of work hours. You paid your own money to develop it.
Yep.
So kudos to you. Sarah, you are a hero, just like
No,
for
thank
going
you.
through this process and showing us that it's possible.
Thank you. Yeah, I hope that my story just inspires other caregivers and nurses and CNAs um, to kind of think outside of the box and there's a solution to every problem. I always say there's a solution to every
Mhm.
problem, and if you can come up with a solution to a problem that will make patients safer and make caregivers safer, then like just go for it. Do it. You can do it.
Right? And you definitely can't do it if you don't try, right?
Exactly.
Exactly. So this brings us to the $1 billion question that I ask every guest on the Nurse Rosa's Insights podcast. And that is, if you were given a grant for $1 billion to meet a need that you see in healthcare, how would you like to see it used strategically to have the most sustainable impact?
I would, as much as I'd say I'd like it to be used for building devices and things like that. I really think that that type of funding would help a lot of people with mental health issues
Mhm.
and with homelessness. It's
Mhm.
such a big problem throughout our country. Um, I think that's definitely where I would allocate that type of funding.
Are there any particular ways that you have seen interventions done for those populations that you would like to see duplicated in other areas?
I don't know. I just think it's like we need to be doing more for them. Like I see every day, like patients just psych patients holding in the ER for weeks at time. Sometimes um, in just like a room without windows, and like I feel like that's the
Mhm.
most inhumane thing you could do to a
Right.
person.
Yeah, definitely. And do you think directing some of it towards like training nurses on how to be more helpful to people in a mental health crisis would be helpful?
Oh, definitely. Yeah, I don't think that we receive like enough training um, for that.
This is why it matters to me so much. Then
Yeah, and
that's
I don't know how I exactly like I would implement the change to make things better for these populations, but um, I don't know. I would find the people to do it. um, yeah, I think that during COVID, we had a lot of patients who were holding in our emergency room with mental health crisis, and there were times where we had like leadership, down in the emergency room, and we're all like, what do we even do? Like there were patients running out of rooms and like screaming and yelling and singing and um just like pure chaos. Meanwhile, you have you know, a department that's also full of, patients who are, you know, acutely ill with respiratory
yeah,
issues and um so I would say that that was probably one of the moments where I'm like, okay, this is like
out of control.
yeah, this is out of control.
Right, definitely. Well, I hope it's gotten better since the pandemic. But yeah, um, I'm definitely always looking for different ways we can improve the situations, because of course mental health issues play into homelessness, as you
Mhm.
alluded to. And so a lot of people have trouble maintaining housing if they don't have the mental stability to go and be at work. So yeah, that's definitely worth addressing. And I think any lives that could be stabilized with $1 billion to have better mental health and be housed would
Mhm.
definitely it would change their whole world.
Mhm.
So that's
I
beautiful.
agree.
All right. Well, Sarah, if anyone has been listening to this and wants to reach out to you and talk to you about inventions or just Louie in particular, is LinkedIn the best way for them to reach you?
Yeah, and you can also visit my website. It's www.stopthesplash.com.
That's awesome. StopTheSplash.com.
Yep.
Very action
And you can follow
oriented.
me on social media too. They're on Instagram. Same, Stop the Splash.
Oh, that's your handle at Stop the Splash.
Yeah.
I love
There's a
that.
little underscore in between each
Oh,
word.
gotcha. But still, that's adorable, and I love
Yep.
it. And for our listeners, if you enjoyed this episode of the Nurse Rosa's Insights podcast, please like and subscribe wherever you are listening. Or if you're watching on YouTube, feel free to comment and reach out to me on social media at Nurse Rosa Speaks. If you have any ideas for future episodes, I'd love to hear about it. And I will see you in the next episode.